Fentanyl is an analgesic or a painkiller. It's typically used for someone who's in high pain, such as someone who is going through cancer. We've always seen a little bit of abuse, just patches here and there, somebody going into a doctor's office getting a patch and then selling it or trading it on the street, but never in the amount that we're seeing it and not in a medical form. What we're seeing now is it mixed in with powders inside of heroin and sometimes just fentanyl by itself. So just statistically, in 2014, we saw 1% of our cases had fentanyl, and then each year it's gone up a percentage. 2015 was 2%, and 2016 was 4%. But 5 years ago, typically what we were seeing here in Central Kentucky was a lot of cocaine and methamphetamine. How this has actually impacted the work area and the dangers with actually sampling heroin and fentanyl is that we actually had to be trained in how to respond with the Narcan kits, which is what's used to revive someone who's had an overdose. What was the big concern is that we would accidentally inhale some, and what fentanyl and the analogs do is suppress the lungs and you basically suffocate. So one of the things that we've encouraged most of our police agencies that bring evidence to the Central Lab is to stop using color test or field test kits because they give false negatives. So an officer will think that they don't have a controlled substance such as heroin or fentanyl, and they may not take the precautions that are needed. With the color test, you get a result based upon the purity of a sample or what's in it. So you may get a mixture of colors, which would give the officer a false sense of security that's not there.